In Uganda, persons with disabilities have made positive strides fighting for their rights and economic empowerment. In June 2000, Uganda National Association of the Deaf and ActionAid conducted a survey in the then Mbarara and Kabarole districts which revealed a grim picture about the deaf. The survey revealed that there were no statistics about the deaf in the sub-counties of the then Mbarara and Kabarole districts. All the districts had not implemented budgeted plans for persons with disabilities. People were ignorant about the Uganda Sign Language. The negative perception about the deaf hindered any program that targets them. The deaf had no skills and knowledge to access employment opportunities. There was limited communication between the deaf and the hearing. The situation of the deaf exposed them to abuse because of inability to communicate effectively. This survey then gave birth to Kambara Deaf Development Project.
Kambara project, it was initially Kabarole Mbarara project, and it was started in 2000 as a partnership between Uganda National Association of the Deaf and ActionAid International Uganda, with a specific objective of creating awareness around the deaf, making people understand the plight of the deaf, and appreciate that the deaf are human beings like any other person in that community.
The birth of a child brings joy to every parent. However, at times, we are not prepared for what these bundles of joy might bring with them. This is what Florence Kisame, a grade 3 teacher, faced when she gave birth to her only child, Sylvia Atuhura. Sylvia would take longer naps, unlike other babies who wake up at any excuse of a bang or something as minor as a hiss within the house. This is when Kisame discovered that her daughter had a hearing problem.
Having given birth to one child, I felt very sad. And I thought if God was nearby, I would maybe collect some good man and go to his office and ask him why me.
She went on to do a one-week training in sign language and hoped this would connect her to her baby. When the training was over, she was eager to get home to train Atuhura the new strokes of communication.
I used to have incidental reading. I would just put gestures, words on objects so that she can read and realize what it means.
This marked the beginning of Kisame's love for the deaf. She started teaching her daughter alongside 4 other deaf children under a tree at the Catholic Church in Kinyinya village. Kisame's vision to see her daughter succeed in life grew bigger and gave birth to Kinyinya Unit of the Deaf, a primary school.
As we talk now, I'm a mother to more than 100 children because all the deaf now belong to me. Sylvia has sisters and brothers. She feels comfortable. We are here to teach them because we were taught we shall teach them seriously to improve their understanding. Then move to another stage. They start P1, up to P7, they understand very well.
In 2001, Uganda National Association of the Deaf, supported by ActionAid Uganda under the Kambara Deaf Development Project, started aiding the deaf unit with sign language manuals and sign charts.
The development of the sign language dictionary, of course, started with the history of UNAD's existence, that the deaf had to have their own language that they can understand, their own language that Ugandans should be able to interpret.
At the time we started the cooperation, we were focusing in 2 districts or areas, 2 areas, HIV/AIDS and education. Because we looked at those 2 areas being the areas where deaf people are suffering a lot. Without education, they were living in the rural livelihoods in poverty.
This partnership has seen Kinyinya Unit of the Deaf Primary School receive funds for constructing a dormitory, vocational center, and a fully furnished dining hall with 2 water tanks. Many deaf children have benefited from this school.
The project has been so good and it has really generated a very positive impact. Even now, me as executive director, I'm one of the product.
Bruno Namanya has just completed his primary living examinations. He is aspiring to be a doctor in the future.
Because me, when I was learning, I know when I finish becoming a doctor, I'll get some money to sustain my life.
Kawasomi's daughter is now employed as an office assistant at the UNAD office in Chegegwa district.
I always sweat working, so they give me some money and I manage my money. I spend very small and I get for myself. If ActionAid had not joined us to promote the education of these children, I wouldn't be the Kawasomi you can see now. I would also look at these deaf children as missed calls.
Kawasomi believes the support got from ActionAid Uganda has pushed them to a level where they can sustain themselves.
The deaf in the villages, since the inception of the unit, they are now perceived as people who can go to school, people who can learn, and people who actually have a stake in the country's development.
In these rolling hills of Isingiro, patched with green vegetation and dotted with banana plantation, lies another story of the deaf striving to make their lives better. Down in Kamuli village, a suburb of Isingiro town, a lonely mother struggles to raise up her child who is deaf. The joy of every mother is to see her child go through all the stages of growth with ease and happiness. Unfortunately, this was not the case for Mariam Katushabe. It's like a wonderful tale that did not end well.
Nagiye kumwetegereza bagira ngo ubundi nabasaka bayinenga kareta twamutwaro wa doctor yamchebera yashanga katarkareka kwonka nuko yaziwe atarkugamba.
When she discovered her son Umar Bwerere could not talk, she tried everything possible under the sun but failed. The good news came when she was told that Umar could attend school at Kajaho Primary School, which has a deaf unit. Time came to take Umar to school. However, the father turned a deaf ear. He abandoned the child with the mother.
Mwese chichancheza gama ntasi mwen kiwo guno gambo tana wantamanya antane begaza sign language ngosi wanonda ngono hakwicha kuza kuvunura ngwakagambira sign language mbeni wanoza kumtunga mpurena kuyanta ntabona rahanga ntananya ubutuma ahumara kunaza kusoma kana hati nishabo wahiku kana shamu mpere omwana wanje ndengu yesha manangwa sesinya ya mkaga hasa ndebe Germany.
Although Mariam had found a school, she failed to raise tuition fees for her son. But like the proverbial saying of a good Samaritan in the Bible, Mzee Peter Tibenderana, who lives in the neighborhood, came to her rescue. Like Chegegwa, the deaf unit at Kajaho Primary School is also supported by Uganda National Association of the Deaf and ActionAid under the Canberra project.
We want to thank these NGOs, we want to thank the efforts of the government to have these deaf children, the group which was not cared for some time back, to bring them to schools and gain something.
Umar has since learnt sign language at school. However, this poses another challenge in the family. His mother is illiterate. She cannot read or write. Using fake sign language, she struggles to communicate to her son.
It's one.
The mother did not go to school. When Umar has to teach that sign language to her mother, it is only that it should be in English.
With the little knowledge Umar attained at school, he tries to make his mom understand by writing on the dusty floor, but all in vain. Someone has got to translate the message in the local dialect, and that's when she'll grasp the message. Umar says this situation also happens with his siblings.
Because sometimes here, because of the language, I feel isolated. When I try to interact with my brothers and sisters at home, I feel I left out. So it makes me sad. Because when I try to ask them to explain or to interpret what they are saying, sometimes they refuse. So I miss information, then I feel sad. Then I go where I can get some information.
Feeling disappointed, Umar walks away from home to meet his classmate Hussein. Like any other person, Umar has got aspirations. He is inspired by the Reverend in his village. He says the man of God commands a lot of respect in the village.
Maybe if I fail to be a policeman, I can be the Reverend to preach. If you are the pastor or Reverend, you move to the different places. For example, Kampala, Iwa, and Mbarara, preaching the word of God.
Looking on with despair, Mariam is uncertain of her son's future and she cannot hold back her tears. She is concerned about the fate of her son if Kambara project is phased out. Many deaf people face the same challenge as Umar.
Arize kunja tati na shomire kuno jauni nshoma ngo inesente atinga shoma atinga gume ninkusindikira message banyanya bambuza baje ngashi message noza kujumsindikira tama shoma atingumani nje basindikira atreru ogume mushomere atingume mugambere.
This family in Chegegwa district has defied odds. Despite having a deaf child and living positive, it has not deterred Sarapio from looking at the future with hope. It takes a strong-hearted man to give the necessary care for his daughter amidst such difficulties. At 50 years, Sarapio Karubanga went back to school to learn sign language so that he can effectively communicate with his daughter.
What forced me to take the majority to Kenya is one. My lifespan may not be for a long period in this world, so I have to live a way or to establish a way whereby my child can be able to remain on this world, because I'm also a positive man. So when I lay a foundation of my child, even if she acquires some skills in handcraft or writing, she can be able to express her feelings through writing.
The bond between the two is so strong to the extent that she keeps close to her father. It's only Sarapio who she confides in on matters concerning her health. Being a Thursday, Juliet asks her dad if it's time to go for a routine checkup. And as night falls, the clock ticks towards 8 p.m. Juliet reminds her father it's time to swallow her medicine.
Now, my daughter, I trained her to read the whole clock. When it clocks 8 and the bell rings, although she is not hear the bell, but when she sees that is pointing at 8 during the night, she just comes around to me, says, "Please, Dad," says, "Hello, I want to take. You give me water to drink." Then I take my pills, then I finish. After taking the pills, says, "I finished. Over."
Juliet dreams one day of being a teacher like her dad.
She wants to become a teacher like the father. She sees the teacher, the father going to teach, and she wants also to become a teacher like him.
The story of HIV/AIDS and the deaf is a silent killer that the hearing world has not given much attention.
Earlier on, the deaf couldn't access information about HIV and AIDS. If they could get a person who could you ask them if he or she knows about AIDS. Sometimes the deaf could say, "Me, I'm suffering malaria." Some, "Oh, I have cough." Didn't know how AIDS is spreading. But through the partnership of ActionAid and UNAD, we managed to go down to train deaf people about ways how they can prevent from acquiring HIV those ones who are infected, how they can access medical. Even we train nurses and doctors how they can communicate with the deaf when they come to access the services. So we have been doing that, giving information.
The challenges facing the deaf are immense. A random sample of one of the health centers in Chegegwa shows that the health units lack a well-trained sign language health practitioner. Robert Kisame, an enrolled nurse at Mpara Health Center 3, tells us how he struggles to treat the deaf at this unit.
Actually, when we received the deaf patients, they present their complaints with the signs, and we don't understand the signs, but some of the signs we can understand. So we deal with those signs that we have understood. Those ones that we don't understand, we just ignore.
Robert is requesting for more training in sign language.
Those are new people. When you are a new person, you come to an area, automatically you have to get a challenge in communication. Medical service providers, you train today, tomorrow they are gone. You have to retrain, to keep on training.
Life in rural Uganda can be a hassle, especially with the biting poverty levels fueled by high levels of corruption. It even gets harder for the deaf who suffer stigma and discrimination in their community.
Bakawaja bampinguza ngumbanta kachiko ka district bamwe bahurira bambenga nguta kurira hatu bakter muci hatu mbenji cyo kikangarira nyuma kureba ngo akarabo kanjira kikamfira hatu nabwo ikibizo bibintu bituye ni to batakurira na batakugamba.
In this lock-up shop in Mbara district, these women are busy weaving all types of sweaters for their clients. They operate under Mbara Deaf Women Development Association, which is supported by Uganda National Association of the Deaf in partnership with ActionAid. The women testify that since the inception of this project, their clientele has grown bigger and the level of income has also risen. Poverty is now a thing of the past.
Now I'm very happy. I couldn't express it, but my expression I could express it into ActionAid, which has supported us. Now I've got skills, I can communicate and do business as a normal person.
There have been economic empowerment programs for deaf women, and these women are able to stand on their own now, and therefore such a program will be able to continue.
Kambara Deaf Development Project has empowered communities at the homestead level with livestock and poultry. This boy has turned out to be a source of pride for this family. When he returns home for holidays, the parents are relieved of all the house chores. The family received a small grant from the Kambara project, which they invested in various business ventures. A study done in 2012 shows that since the year 2000, the project has reached a total of 2,435 beneficiaries through the formation of community groups and provision of cash support. Out of these, 35% are deaf persons.
Project erioneza kwaho konka tugisima ahabo kuba ikatutandikira ho musinje murunje bakaba batugambira ngo ibintu byo kutereza tukoremo ibintu byo permanent ibyo kwija kwihamu abana bitwugumiza muno bashoma nabwo cyo kwaho kwayo nutureba ngo namaze maneza kwaho ebireneti yamba kandi kagumereneti yamba abo kuba banka amashomero ga secondaries na make.
The evaluation found that the economic empowerment programs had some impact. Some of the project beneficiaries were able to transform their economic status using the benefits they accrued from the project. Kambara Deaf Development Project has indeed become a household name in this part of the country. The smile it has brought in the faces of the deaf people is a sign of success.
The project was the savior, and it is still the savior. in a sense that before the project came here, people with the deafness were being seen by the community as people who are useless in our community.
In the education sector, illiteracy levels have gone down among the deaf, and there is increased utilization of sign language communication as a media for the deaf.
Now, the good number of deaf pupils have access to education. Some are in primary school, some in secondary school, some have got jobs through the partnership of ActionAid and UNID. There are so many youths who are in school. Well, for example, I have gotten a job, and many deaf, now they have started marrying.
Many have assumed leadership positions both in civil service and the NGO world.
So people even are accessing our offices without fear, and we are talking with them because some of us were sensitized in sign language, and we can interact with them.
The deaf can now demand for their rights without fear of stigma and discrimination because they are economically empowered.
When the project came, sign language was started and has helped a lot, has bridged the gap of communication.
On the HIV/AIDS front, there is increased awareness and access to health services. A study done in 2012 indicates that the Canberra project contributed significantly to increasing awareness on HIV/AIDS among the deaf.
So now, even now, the deaf knows how to protect themselves against HIV and AIDS. So because of a lot of sensitization, how to use a condom, how to use the strategy of ABC, how to go and check their cell status in the hospitals, so they know.
The evaluation shows that 91% of the deaf people have heard about HIV/AIDS and possess fair knowledge about HIV prevention, care and support. 72% of the deaf attributed their increased awareness about HIV/AIDS to project activities. Beyond learning and knowing about HIV/AIDS, 83.9% of the deaf have tested for HIV/AIDS. Nevertheless, there is need for more in-depth engagement of the deaf in order to increase their knowledge in care and support for HIV-positive people. With these positive strides so far taken, there is improved esteem and feelings of self-worth, hope and optimism among the deaf.
When 2 or 3 deaf go together in town and signing, they could hold one arm that you are going to shame yourself, thinking that the language by then they were using, it was the monkey language. But now, the deaf themselves, they can go publicly signing without shame. They know it is their mother language now.
There is no doubt that Canberra Deaf Development Project has touched the lives of many people that they would not want to let go of this wonderful project.
I think the future can be bright if, as of now, like this 2 years phase-out plan of ActionAid, this phase-out plan, I think it's very important, UNID and ActionAid, to partner more, focus on other, networking with other organizations.
We are not phasing out the entire programming around UNID. And therefore, this process is basically to look back and see what have we got in the last 12 years with the investment we've had in these locations with UNID. But the programs of UNID are expected to continue beyond the phase-out period that is 2015. So phase-out doesn't entirely mean we'll be closing and packing up our bags and going away and leaving the communities blank.
But as the Chinese proverb goes, give a man fish and you feed him for a day. Teach a man to fish and you feed him for a lifetime. This was the overall objective of the project, to build the capacity of the deaf to be able to access opportunities, demand for their rights, and improve their social and economic welfare.
And I was poor in body and spirit, and I was living, and I won't say that I was alive.